record on this computer. Um,
Let me, hopefully it will let me share my screen. Okay, fabulous. And if not everybody can see that, please speak now or forever hold your peace. Brilliant. Okay, well, thank you once again for joining us today. I'm going to give a brief presentation about our report. I hope you've managed to have a look, even if you haven't read it cover from cover. And this will give you just an overview, but obviously there is a lot more information in the report. And I look forward to any questions you may have after the presentation. There we go. So just a brief reminder of Health Watch Somerset and who we are. So the Health Watch Network was created in response to the Health and Social Care Act. We are independent and we're publicly funded, but indirectly, and we are not for profit organisation. We are one of 152 local health watches, and there is also a Health Watch England, which works on a national level. We don't charge for our information or advice. So our functions are mostly to listen to your experiences of health and social care services in Somerset. Any feedback that is given to us is absolutely vital, and what people tell us is kept anonymous. So we do get people coming to us with feedback when they don't feel that they want to give it to the service, just in case they're looked upon unfavourably. Of course, they never should be, but it is a very real and normal sort of uncomfortable thing that we feel sometimes when we're talking to a service about them. So we work directly with service providers, also the NHS, the Somerset Council, and the public, and we also work with the regulators, who are the Care Quality Commission. And we research and provide evidence to help influence decisions to improve the quality of services. So a brief background to our report. When we do a piece of key work like this project, we always look into what may have been previously done. There are more examples within the report, but I thought that it was worth pulling this one up, and this was taken from the Somerset Transformation Plan for Children and Young People's Mental Health and Wellbeing, 2015 to 2020, such a long time ago now. And it actually said services need to be simple and easy to access, built around the needs of children, young people and their families. It needs to be outcomes focused and based on best evidence. It stated that children and young people and families need the right help at the right time and place to prevent mental health difficulties. And that was back in, when they put that together, it probably was about 2014, 2015. So we also looked at what some young people have said. We've got some more recent material for that. So there was a piece of work done by what was previously the Clinical Commissioning Group and is now known as NHS Somerset. And that was a report called Your Views Matter. And one of the quotes from there says that people would like to see easier access, increased availability, more suitable services, and better communications about the services that are on offer. We also have done a piece of work during my time at Health Watch Somerset. We had a youth engagement officer who undertook a 18-month engagement project with young people around Somerset, where he built up some young listeners. And the project report, sharing young people's feedback to improve health and social care services, picked up a quote that said, many services do not promote themselves in a way that is accessible or inclusive of young people. I think it's important at this point, I know we're all professionals on this call, but it's just worth noting the importance of language, which is why I've included the definitions for a difference between access and accessibility, because they are words used throughout the report and previous reports. So access is to be able to use or obtain something such as a service. So that might be walking through the door or making an appointment. And accessibility is the quality of being able to be entered or used by everyone, including people who have a disability. So you might access a GP through the front door, but if you're in a wheelchair and it doesn't have a ramp, then it's not very accessible. I hope that makes sense, but it's just worth bringing that point forward. So in the report, I put in a chart that was taken from the NHS Mental Health of Children and Young People in England. Now, the chart in the report is only up to 2022. Since the publication of this report, they've actually published the new results for 2023. So hot off the press, I updated the chart for the presentation. And you can see there the changes in the percentage of children and young people with a probable mental health disorder. It's obviously sorted by age, and it includes the years 2017, 2020, 21, 22 and 23. So we're getting a snapshot of pre and post COVID there. Encouragingly, the 2023 results show that 17 to 19-year-olds with a probable mental health disorder, the numbers have dropped very slightly. Unfortunately, the 18 to 16-year-olds have actually risen very slightly. So it's just worth noting a bit of the state of the nation. Those are national figures, not local figures. So the aims of the project that we undertook was to better understand children and young people and their families as well, their knowledge available of mental health and emotional wellbeing services and support. And we also wanted to investigate how relatable mental health and emotional wellbeing services and support are for their target users. And just because we don't like jargon, I have put a little explanation of CYP there, which is children and young people. So Tell Me is an app that is funded in part by NHS Somerset, that offers free, safe and anonymous support for children and young people. And they download it to their phone, and then they can send messages and they can receive support back. So before we even started the survey, we did meet with a variety of organisations who deliver mental health and emotional wellbeing services across Somerset for young people. You can see a few logos there. They're just a few of them. We contacted organisations involved with young people and requested the opportunity to attend with their groups to help shape the project materials, or to gather feedback once our actual survey had been produced and launched. We did speak to 26 young people who provided feedback for our draft survey questions. So when we spoke to young people about our draft survey questions, they provided some really interesting insights to what we'd done. And we did make some important changes to our survey based on some of their comments. The use of graphics, which we wouldn't normally do, obviously, in an adult survey, but quite rightly, it was a good point to make because it was quite a wordy survey. We felt it had to be in order to get some of the information that was really important. So we did put in some graphics to help break up that text and make it a little bit less scary or off-putting. And we did hear that people enjoyed giving their opinion. It made them feel valued, knowing that they could make a difference. So then we did move on to the public engagement. And what we did for that was produce a survey that was aimed at young people, and we asked adults to fill it in as well. They could do it either on behalf of a young person, or they could do it as an adult. We did speak to some youth groups about some of the promotional materials, and we also joined 5 youth sessions and 1 parent carer meeting, and asked them to fill out surveys for us as well. We did promote the survey through a wide variety of organisations, and I have to say at this point, all of the organisations I engaged with were really helpful in sharing our poster and promoting the survey itself. We wouldn't have got it spread as far and as wide as we did without them. Everyone was very supportive of this work. We did go to 7 public events. We did over 40 social media posts, and we placed 11 posters around the county. So as I said, we did produce a survey. That was a bulk of the investigation. And we asked young people about their need for support, whether they sought that support if they felt they needed it, and who they felt they trusted they could talk to. We asked them about their knowledge of both some national and local support services, and we defined that as direct support. So that might be a telephone line or a text service, web chat, where you would be interacting and getting responses, or signposting and information, which might be a website that directs you to some direct support, or would provide some leaflets or some advice and guidance in a written form or a video, but there wouldn't be any interaction involved. And there's also some support apps out there, and we put those in their own little category. We also talked to them about what it was like to contact services, and if anybody had, what their experience was of using those services. We also wanted to look at promotional materials. We are aware that there's a wide variety of different formats out there, and we wanted to know what appealed to young people and what didn't, because we want to help inform services who may be developing new materials, to give them an idea of actually what young people felt about the materials that were currently out there. So we did ask young people about takeaway formats. So that would be what kind of information would they pick up, and we asked about bookmarks, leaflets, and little wallet cards, which are kind of like business cards, or could even be folding business cards that they would put in their wallet or purse. And we also asked young people to comment on 4 posters that we showed them as examples. So we weren't looking at the service, we were looking at the different styles of the posters, and we asked them what they liked, disliked, and anything they might change about those posters. So we had 85 responses to the survey, and 65 of those were from young people aged 11 to 25. In all honesty, the majority of those 65 were filled in through face-to-face engagement. So we had very little uptake of the online survey directly, but when we went out and engaged at events and when we went to youth groups, we got a really positive response. It's not entirely unexpected, because we know with young people, they have very busy lives. And getting them to fill something in, if you get them to take it away and say, oh, go online and fill this in, is one of those things that could fall beside the wayside, given homework and socializing and all the other things that they get involved in. So it was really encouraging when we did face-to-face that we had such positive responses, and all of those young people were aged between 11 to 25. 46 of our respondents said that they had a disability, and the responses came from over 25 different postcode districts. Okay, and I just wanted to point out there that some disabilities are not visible. Sam Vesti appeared in the Bridgewater Mercury earlier this year, and that's his campaign for a new blue badge sign. We wish him all the best with that, because I think that's a really good idea. So the key messages that we pulled out from all of the data we received is that 80% of young people felt that they did need support with their feelings in the past 12 months. Now, in the report, we did have more people who responded to the question, but the 49 of 60 is representative of those who actually gave a response. There were 7 people who either did not answer the question or said they preferred not to say, and we didn't include those in that set of figures. 47%, so that's 21 out of 45 young people, who said they felt needed support, didn't actually ask for it, which is in some ways not surprising, but quite saddening. And it's almost 50%. So it's possibly something that services or people may want to think about how to approach that. 11% of respondents hadn't heard of any of the Somerset services that were offering direct support. So at least 81%, 89% even, get my maths right, had heard of at least one service, which is quite encouraging. Young Somerset was the most contacted Somerset support service, and schools are seen as a crucial source of information and signposting for both young people and adults. So we heard parents, when they filled in the survey, say that they went to the schools to look for help, to look for advice about where they could get support for their young person from. And many of the comments did indicate a lack or limited knowledge of the available support offers in Somerset. So although 11% of young people, 89% of young people had heard of some services, they may only have heard of one. They might not know what that service offered. It was just a name that they'd heard of when we asked them. So how do young people feel? The survey indicated that many of the young people we spoke to did feel they needed support with their feelings in the past 12 months, as reflected in our key messages. And just over half of those said that they did look for help. The most common reason given for not asking for help was, I don't like talking about my feelings. Hardly surprising when you're a teenager. I believe the main form of communication might be grunting or text speak these days. I don't know. I'm showing my age there. And the most popular trusted person young people chose was a friend, and the next being a parent or a guardian. So we've just added a couple of quotes in there. I felt like I couldn't talk about my feelings and that I would get judged. And I can't talk about it, but I talk to friends. So again, those were just comments that reflected our findings. So when it comes to knowledge of services, as you can see here, the young people who knew about Cooth was 36 people who responded to our survey, said they knew about Cooth. So that's the most well-known direct Somerset service amongst young people, whereas CAMS was the most well-known service by adults. And proportionately, you have to remember that 65 of our responses came from young people. So only a small portion of adults answered, but a large portion of those adults said that they were aware of CAMS. So it's just a little idea there of the differences. We weren't able to put a chart quite like this into the report, although those figures are in table form in the appendices, and there is a pie chart showing the combined responses in the main body of the report. So we had some results about our promotional materials. 23 young people told us which types of printed material they would pick up. Some of them did say they would pick up more than one type of material, but the overriding answer was the wallet cards. And some of the reasons for this were that we were given were they're small, they're discreet, you can hide them behind your phone. Just talking to young people, obviously at that age, their privacy, their identity is quite important to them. And regardless of the reasons why, they didn't always want parents, adults, school teachers to see them with those kinds of materials. So those small wallet materials were preferable, and those were some of the reasons they told us why they preferred those discrete materials. 9 people said they would pick up a bookmark, again, something that's small and functional. Nobody said they would pick up a leaflet. There was quite a lot of, no, I wouldn't read that. There's far too much information. And as you can see, we got a lot of comments about the posters. The one that received the most unfavourable comments was the Somerset Apps Library. We knew that was probably going to be the case. And in fact, I did speak to NHS Somerset, who have created the apps library, and they were keen to hear what young people felt about that poster, because they were aware that it was probably not going to appeal to them, as it was mainly targeted at adults. So that wasn't a surprise. And we received some really interesting comments. One of them was, "It looks like a trifle," which I thought was a lovely comment, really. So thank you very much for bearing with me through that presentation. If you want to get in touch with us, there are our details. You can go onto our website, or you have my email, I believe, all of you, and you can contact me directly. So that just leaves, are there any questions? I'll stop sharing now. I've got to find how I can not share. Yeah. Oh, there we are.
Thank you, Kirsty.
Oh, there we go. Thank you, Kirsty.
I think for me, I just want to say well done for all your very hard work. And it's great to see young people at the forefront of this work as well. And I had some thoughts about the school thing, thinking, well, if that's young people's go-to places, what about those who aren't in education? You know, how do we capture that? That's some food for thought from me, really. But yeah, amazing work and well done, because it's inspiring.
Thank you, Val. And absolutely, it's something I'm always sort of talking about when I'm around young people's groups. And you will be aware there was a Participation Workers Network meeting today, where they presented the preliminary findings of the school survey that was done this year. And again, it came up by other people as well. What about those young people who aren't engaging with school? I would love to be able to. It's just finding the way that we can manage that with the resources available, and that they are a notoriously difficult group sometimes, depending on who is homeschooling them, and whether they're involved in wider homeschooling groups or not. So it's something we're definitely keen to try and do. And certainly in the future, I want to keep engaging with young people. We may well, and it might be a question that we ask when we engage with young people in the future, we may well have actually come across some of those that were homeschooled. I visited 2 youth groups, and we did engage with some people at public events, who may or may not have been in school. So we didn't actually do any engagement within the schools. So there was potential there. I'm not saying we did, but it's possibly a question we could ask within our demographic information the next time we do a piece of work.
And I suppose you may also have those residential schools, which are part of children's residential homes. That might be another area to think about considering to gain views.
Absolutely. Yeah, no, that's a really good point. And I didn't realize that they actually have to be registered with an NHS local doctor. They're not allowed to so private schools aren't allowed to have private doctors. They have to have NHS doctors. So that's a very good point.
And things like the pupil referral units as well, I think. I mean, we're currently in the process of pulling our long list together for our work plan for 24-25. So I'm going to take this opportunity just to mention that. So our decision-making process means that we look at the feedback we've been receiving, the intelligence we've been gathering collectively through meetings we've been attending. We start with a long list, and it's currently it's about 2 or 3 pages worth of topics that people are telling us that they're concerned about across health and social care. We then try and narrow it down with much much angst in many ways to 5 or 6 topics that we then go out to public vote for. So we are at the kind of the long list stage now, but certainly, you know, Tanya and I have been having conversations about keeping children and young people involved in our work going forward, in whatever form that takes. But yeah, certainly I can't say hand on heart, but I have a fair idea this won't be the last piece of work that we do around mental health and emotional well-being. And certainly we are interested, but can't currently commit to following up on this as well. So
And just to add on to what Jill's saying there, Jill is talking about our key projects. I certainly identified early on in this piece of work that I want us to undertake more regular engagement with young people. So it may not be a key piece of work, but I definitely want to be speaking to young people on a more frequent basis and asking them about what's working for them and what isn't working for them in health and social care. So not just necessarily about mental health. And I have been looking into this, and I'm hoping to go. Some of the youth groups that I visited have said, absolutely, we'd love you to come back. So that would be an opportunity. And other avenues, thanks to you, Val. And hopefully we're going to be speaking to the care leavers in Bridgewater, and working our way further and further afield. So you know, it's obviously a process, and we also have to take into account there are many other people who are undertaking work with young people who are asking for their opinions as well, and balancing it out.
Yeah.
And I don't think anybody would mind me saying, but I do believe that the youth forum, who are being revamped, that was announced again today at the meeting, they are going to be looking at the children and young people's transformation plan, mental health and wellbeing transformation plan, in the first few months of next year. So that's one of the first things the youth forum will be talking about at the beginning of 2024, and that will be really interesting to hear the results from that as well.
okay, I'm going to stop recording then in just a second, but can I just say, if there are no other questions, thank you very much for joining us this evening. We hope you found that interesting, and we look forward to working with you going forward. Stop recording.